Good afternoon. Thank you for the opportunity to present this work here, entitled Promoting the Urinary Continence of Hospitalized Elderly Limits and Possibilities of Nursing in Brazil. The object was to know how nursing care occurs related to the promotion of urinary continence of hospitalized elderly and what are the limits and possibilities for this care to occur. This is a qualitative approach research, where I used the triangulation of data collection techniques. Initially, an integrative literature review was conducted and then we developed the field research. The field research was composed by observed non-participant nursing care and focus group workshops with nurses in a medical clinic unit of University Hospital in northeast of Brazil. After content analysis of the results obtained, 4 thematic categories emerged. The first dealt with the influence of hospital structure, where aspects related to the availability and disposal of human resources, material resources, and physical structure were raised. The second category was related to the lack of screening, knowledge, and recognition of the nursing staff regarding the problem. The data revealed that most nursing staff considered urinary continence as a normal consequence of aging and could not be treated or prevented. In addition, they reported prioritized measures to reverse the main cause of hospitalization, and secondary conditions such as incontinence is not prioritized. The third category was related to nurses' culture of using urinary control device in the hospital environment, as geriatric diapers, even in elderly people with preserved urinary continence function. The fourth category was related to the nurses' actions that influenced the preservation and rehabilitation of urinary continence of elderly hospitalized. Few actions were identified in the study scenario, such as environmental adaptation, family or companion education, and stimulating functional independence and mobility. We conclude that nursing care in the study scenario related to the promotion of urinary continence still occurs in a punctual and non-systematic manner. We found as limitations to this care factors such as hospital structure, the culture of the indiscriminate use of urinary control device, and this deficit in the screening, knowledge, and recognition of the problem by nursing staff. And the possibilities for expansion, the importance of education interventions, dissemination of evidence-based studies related to the theme, and the strengthening of multi-professional work. Thank you.
The floor is open for questions.
Thank you. There's so few studies looking at continence issues in hospital. This being a qualitative study, one of the key issues is being very transparent about how the data were interpreted and whether or not that's your interpretation of what the nurses said or whether that's actually what they said. So you came up with some findings around, the use of products. Did they say we use products or is that your interpretation thereof? It's the issue of researcher reflexivity.
Related the culture of using urinary control device, the product geriatric diapers and catheters, urinals. Yes?
Yes.
Such as geriatric diapers and blood catheters, we observe the need for instrument study scenario that standards the established criteria, its use in care practice, avoid its consequence. It's criteria of use device, geriatric, bladder catheters.
This is what you observed, yes?
You observe non-participant of care nursing and focus group with the care team. Focus group. Foram two. I observe, prioritize, then I focus group. Two methods. Techniques.
Okay, 2 techniques, right. Thank you. Thank you.
Thank you very much.
Sorry.